This is a system screening presentation of the drug scopolamine. Scopolamine is classified as an antimuscarinic, antispasmodic. The indications for scopolamine are motion sickness, post-op nausea and vomiting, surgery, and Parkinson's disease. Scopolamine may be an alternative to other antiemetic medications like over-the-counter Dramamine. There are a few ways that scopolamine can be administered. They are orally, intramuscular, direct IV, subcutaneous injection, topical application, and transdermal system. Dosage for scopolamine is going to depend on the age of the patient. Pediatric patients are most often using scopolamine for motion sickness and post-op nausea vomiting. Their sub-Q dosage is going to be 6 milligrams per kilogram. In adult patients, we found that the most common use of this drug was through a transdermal patch. Each patch contains 1.5 milligrams and it is delivered 0.5 milligrams each day. Patients would then take off their patch after the 3rd or 4th day and reapply as symptoms occur. The warnings for scopolamine include possible adverse CNS effects, which could be the cause of euphoria, amnesia, fatigue, and hallucinations. Possible ocular effects with increased ocular pressure. Idiosyncratic reactions, the most common being acute toxic psychosis. And then there's also possible drug withdrawal symptoms. General precautions to look out for include cardiovascular and GI effects, patients who have Down syndrome, spastic paralysis, or brain damage, respiratory or GU effects, and those with seizures or psychosis. Drug reaction is going to depend on the administration of scopolamine. For oral drug therapy, you'll see dry mouth, dry skin, drowsiness, flushing, tachycardia, urinary retention, mydriasis, confusion, short-term memory loss. Transdermal therapy, common adverse reactions are dry mouth, drowsiness, dizziness, blurred vision, mydriasis, and short-term memory loss. All other therapies are going to include dry mouth, dry skin, tachycardia, urination retention, mydriasis, and short-term memory loss. The ones that we saw most common throughout all of the administrations were dry mouth, short-term memory loss, and drowsiness.
The mechanism of action for scopolamine is it's a non-specific competitive antagonist of acetylcholine at muscarinic receptors. So the drug is competing with the neurotransmitter acetylcholine for those receptor sites, and it's going to block the effect of acetylcholine at wherever the receptors, the muscarinic receptors are, therefore blocking the transmission of cholinergic impulses from the vestibular nuclei to higher centers in the CNS and from the reticular formation. The pharmacokinetics, despite the administration, it's absorbed in the upper small intestine in the GI tract, and orally it's well absorbed as well as transdermal, it's well absorbed, and then intramuscularly and subcutaneously it's rapidly absorbed. It's metabolized almost completely by conjugation in the liver. It's distributed reversibly bound to plasma proteins. It can cross the blood-brain barrier and it can cross the placenta. Its elimination is through the urine as metabolites, and less than 5% of scopolamine is excreted unchanged. Scopolamine is a prescribed drug, so it does require some monitoring. You need to follow the label as prescribed. You need to use, especially with caution, if you have a history of seizures or psychosis, because the effects will be intensified. You need to use caution if you are pregnant, lactating, if you're a child, if you're in the geriatric population or if you have hepatic or renal impairments. But for the general population, scopolamine is a safe and effective drug with minimal serious side effects. Special consideration, so if you are pregnant or lactating, you need to use caution due to the fact that scopolamine can cross through the placenta. Pediatric use, you are more susceptible to adverse effects, and you do not want to use scopolamine transdermal in children since it is not known if the system will release an amount of drug that could cause serious adverse effects. In the geriatric population, you have an increased incidence of mental confusion and other adverse CNS effects. And with hepatic and renal impairment, you have an increased incidence of adverse CNS effects. In physical therapy, you need to be aware of scopolamine and understand the adverse drug reactions of this drug and be able to recognize these signs and symptoms during therapy. It's important to know these signs and symptoms so you can educate your patient on any risks of the drug or any side effects that they may be experiencing. And drowsiness is a big adverse drug reaction, so you want to make sure you time your PT sessions accordingly so your patient is aware and alert and knowing what they are doing. And you also want to caution the patient about just normal activities of daily living, such as driving. What we found with some studies is one of the main side effects of scope is memory loss and impairment. Lots of recent studies use scopolamine in rats to impair their memory and learning so they can test their theories on different treatments to improve memory diseases such as Alzheimer's disease. Another study we found was on how transdermal scope was used on post-parotidectomy. So an uncommon complication of this surgery is parotid fistula, which is connections between the skin and salivary ducts, which saliva is discharged. And they right now do not have an effective treatment for this complication, but they found that transdermal scopolamine is a valid option in treating this issue without causing any collateral side effects. Another study found that scopolamine can reduce cyclate-induced tinnitus through reducing cortical hyperexcitability by reducing the gap-induced auditory cortex offset responses. So overall, scopolamine has kind of a broad range effect because of the multiple locations of the muscarinic acetylcholine receptors, and it has many effects in regions that contain these receptors due to that antagonistic effect.